So I've said the connective tissues in our autonomic nervous system, and this affects our heart rate, our digestion, our blood pressure. Dysautonomia, that's how I pronounce it, you might say it in a different way, is used to describe the autonomic nervous system not working correctly. So lots of people can get issues with dysautonomia, not just EDSAs, but there's a particular area where this is more apparent. And there are different systems. So the sympathetic system helps with the blood pressure, heart rate, and responsible for our fight and flight responses. So in response to any perceived threat, response to the body, like for me, it used to be muscly, sort of hairy spiders, we get a sudden whoosh of adrenaline to deal with the threat. And low or high blood pressure, increased heart rate and breathing, and so on. So the sympathetic nervous system deals with this threat and compensates with this huge rush of adrenaline in case we need it, and fluctuations in our heart rate, so we get the breathing issues. And the interesting thing here is that the sympathetic nervous system, or SNS, can mimic symptoms of anxiety that are an anxiety disorder, but is actually physical. So one of these triggers I mentioned before is stress, which can lead to heart and blood pressure, but it actually comes from a physical cause. So I know when it's happening for me. I've been actually part of a study, and I know when it's happening. I can actually hear it and feel it. I can't stop it happening, but I think knowing about it and being empowered to know about it, why it's happening, now lessens the reactions I used to have, which were very, very extreme in the past. So management of physical anxiety, maybe we need a different approach or an extra approach to what we think of as an anxiety for autistic people. And that's very key for people with Ehlers-Danlos syndromes, and maybe a different approach to, say, cognitive behavior therapy or counseling, because it is actually a physical, involuntary anxiety. And the parasympathetic nervous system, that deals with the rest and digest, and possibly some other issues with stability in the nerve and neck area as well, like the vagus nerve. So it's quite complex, but there might be a reason, and I think it's a really interesting sort of research study that some very clever people might look at later on. But what it does for people with postural tachycardia syndrome, we know that it predominantly is symptomatic with girls from 15 to 50 years. And women with hypermobility Ehlers-Danlos syndromes, or HSD, often experience postural tachycardia syndrome. About 78% probably of those with heads. The main symptoms occur when the person is standing upright. So from lying to sitting, or sitting to standing. And common symptoms are dizziness, weakness, lightheadedness, fainting, breathlessness, shaking, fatigue, sleep issues, and so on. Raynaud's. Brain fog is very key, particularly for those in school when they're meant to be getting, great grades and exams, but they're really academic, but they just seem to not be able to do it. And it also affects some other levels. So hormonal changes can be part of the issue. And there's a website there if you want more information in the UK. And I'm sure there's one in the USA as well. Anxiety, there are different types of anxiety. We know that a lot of autistic people do have mental health issues, particularly depression and anxiety, but it's always seen as a mental stress or anxiety. We know now that it can be mimicked, if you like, a physical anxiety. Our interests used to be called obsessions, when I first started learning about autism, in quite a derogatory manner. But I always felt interests are key to our motivation, and I call them passions. Now, my passion is Ehlers-Danlos syndrome, interestingly enough, and hypermobility spectrum disorders, which is really good because I like it. And but also more than that, it's incredibly important. And having nearly died and seeing other people really disabled, I think it's incredibly important. And this is what I have set out to do. And I hope more is done in the future. I think people with hypermobility syndrome do present as anxious, but why? And there is a study, it's in the references, Dr. Eccles, that people people with joint hypermobility are 16 times more likely to have panic or anxiety disorders. So that links to the autonomic nervous system. And hypermobility is also linked to other disorders like fibromyalgia, chronic fatigue syndrome, stroke ME, and irritable bowel syndrome. So do have a look at the references if you want to know more. So with Ehlers-Danlos syndromes, girls and boys are both equally affected. But we know from puberty, girls become more symptomatic, or those non-binary, if they're taking female hormones, because testosterone builds up muscle mass. And if our musculoskeletal system is weak due to laxity of the connective tissue, then we do need very strong muscles to help. So testosterone overcomes the natural tendency of laxity. Estrogen and progesterone seem to worsen symptoms and affect the connective tissues more and can influence the hypermobility more. This is still a research area to look at, and it will affect our pain issues, and it causes our ligaments to become more lax, and possibly, other times as well. So, like pregnancy or menopause, things like that. So definitely, I know that from my point of view, pregnancy was an issue, and I definitely became very, very dizzy and very low blood pressure, to the point where I was told that if they had blood pressure like mine, they would be stretched out horizontally asleep. But that was my normal, really. So it's an interesting area, and particularly hormones. If a lot of women still don't get diagnosed, and so it sort of crashes during this time.